One thing that really strikes me, it strikes me every day in the office, is what a great clinical challenge we have with prostate cancer. And I mentioned to a resident who's in the office with me today that I can't think of a cancer that any of us face personally that has this many open-ended questions. How many cancers do we know about where the value of screening is totally unclear, where once you have the diagnosis made, the correct treatment of choice is really not clear? There are very few. Most, colon cancer, you need a colectomy plus or minus chemotherapy. If you have breast cancer, you need a lumpectomy and radiation or a mastectomy. But in prostate cancer, we're faced with these incredible challenges, these incredible questions. And we battle that every day. So it's a very difficult state of affairs. And I'm hoping that the molecular biologists, the rational drug design, everything that you guys have been talking about today in various contexts will take this clinical problem away from us and that we'll have a much better treatment in the future. But until that time, as clinicians, we're stuck trying to sharpen our razor's edge, to use a pun as a surgeon, but to try to get as much advantage as we can from the technology we have today to improve treatment. And as you see here, there's been a major change in the way we treat prostate cancer from a surgical point of view. Only a few years ago, the vast majority of surgical cases were dealt with by an open prostatectomy, about 80%. And you've seen a total shift. In about 2 years, it's 63 or more cases are dealt with by this robotic approach. And that's something I want to talk to you a little bit about today, and how we're trying to clinically get closer and closer to a near-perfect cure, if we can, surgically, until some of the molecular biological approaches get us there without the crude approach of the knife. So why do we see this shift in treatment strategies from a surgeon's point of view? What has happened to the market here? Is it because of less bleeding? Yes, that's reasonable, and that's an objective benefit from robotic surgery. Smaller incisions, yes, we're doing it through keyhole incisions, but you add up 6 small incisions and maybe it equals the length of a traditional open operation. I'm not sure how much advantage there is. Is there oncologic efficacy? Well, I think most of the data supports that there's equivalency, unlikely to be superiority with a robotic modern approach. What about continence and potency and functional outcomes? Well, we're cheating for each little sliver of benefit that we can, and perhaps there's small amounts of benefit from these modern surgical techniques, but that's what we're pushing for and striving for. Part of it, obviously, is urologic marketing. This was a slide lifted off from one of the reps from the company, and you see on the top left-hand corner, driving the curve. When they're driving the marketing, and they're driving the care of patients for sure, but it's not only marketing. Some of the marketing comes from the surgeons themselves, myself included. We all try to get ourselves out there and our product out there, obviously believing in what we do, but there is a marketing aspect. These were the first surgeons to perform a robotic hysterectomy in the Mid-South, and I wasn't aware there was a Mid-South. But so again, everyone's striving for their particular edge or one-upsmanship. And that's clearly something that we need to sift through as patients, as friends of patients, as family members of patients, as surgeons and clinicians. But this is a slide from my partner, Dr. Cavusi, which is a great slide. And he says, his aunt who lives in Brooklyn, sometimes she'll walk the extra 3 or 4 blocks to get the apples at 3 cents cheaper, per pound, because sometimes small differences can matter. And perhaps that's what we're dealing with prostate cancer surgery. We're dealing with small margins in terms of literally in terms of margins of oncologic control and efficacy, and we're dealing with potency and urinary control. So if you're talking about a slight edge in urinary control that you recover perhaps in 2 to 3 months rather than 4, 5, or 6 months, well, that can mean a lot to some people. If your rates of erectile function are a little bit better, a sliver better, well, maybe that matters.